Hi everyone, happy Sunday night. Hope it's been a great weekend. Sorry for my late submission since I'm last to the game. You already know that we are talking about Healthy People 2020 and with the focus area of heart disease and stroke. I found 25 objectives, most with multiple sub-objectives, and I really took a look at them and put them into some different categories. So I found 5 different categories, and then I have a couple of ahas to share with you at the end. See if you agree with me. So the first category I found, I have notes too. The first category I found was general overall objectives, such as reducing the number of stroke deaths, increasing cardiovascular health, reducing the number of people with hypertension or pre-hypertension. So general overall population health objectives. The second category I found was regarding people's behavior that contribute to better cardio health. An example of that would be there are objectives that are measuring people having their blood pressure taken within the last 2 years. I think there was one about having had their cholesterol checked in the last 5 years, and one about adults with high LDL adhering to their meds. Another category I found was regarding specifically risk factors, increasing the proportion of people with pre-hypertension who have met the guidelines for healthy BMI or saturated fat consumption or alcohol consumption or sodium intake. So really focused on measuring, targets and measuring specific risk factors for heart disease and for stroke. The fourth category I found were objectives on people's knowledge. So there was an objective on knowing the early warning signs of heart disease, heart attack, or stroke. A really interesting knowledge objective that I found was knowing the importance of early warning signs and detection. So if you think about Bloom's taxonomy in learning and in cognition, knowing the warning signs, you memorize those. Knowing the importance of the warning signs and taking action is a higher level of cognition. It's more conceptual and a more difficult thing to measure and a more difficult thing to do. So that's an interesting target, I thought. The fifth category of objectives in the Healthy People 2020 focus area of heart disease and stroke to me look like measuring the timeliness of different events. So there was an objective about measuring the timeliness of getting patients to emergency treatment or the timeliness of getting them connected to rehab or follow-up care. I had 3 ahas. One of them is that there was an acknowledgement on one of the first pages that I read in this section, an acknowledgement of the disparity for race and ethnicity and SES for the prevalence and incidences of heart disease and stroke. But I didn't see any targets that were aimed at making specific improvements for different races, different ethnic groups, different levels of socioeconomic status. I saw age groups. I saw targets for age groups, and I think I saw targets for men and women. but I did not see targets for something that they actually acknowledged was an issue. So hopefully in Healthy People 2030, they actually will set out specific targets for these especially vulnerable subgroups of the population. Also, I felt missing was any targets around smoking cessation. Smoking is a risk factor for both heart disease and for stroke, and so it really surprised me that there were no targets listed here. So I didn't have time, but maybe there's a specific section in Healthy People 2020 that talks about targets for reducing the number of people who smoke in the United States, cigarette smoke, or using tobacco. But nonetheless, I think it should have been at least acknowledged in this section that, referred to the other section that it was. Hopefully it's there. Maybe you guys could see it. And the last kind of interesting and aha objective that I found was the one that is looking to increase the proportion of adults with elevated LDL who have been advised to take medications to lower their LDL. So I thought that one was interesting because that's actually measuring healthcare workers' behavior, not anything that the population is doing. And so number one, I don't know how you would possibly measure that so that you know whether with any accuracy. And number two, how would we possibly get every healthcare provider in the country to advise medications to people with an LDL that's elevated? I mean, we can tell healthcare providers to do it, but how would we actually follow up and make sure it's happening and then measure it? Seems like a throwaway objective that there's no way to really know. So those are my takeaways. Hope you have a great week ahead, and I'll aim to get my next work done before the 11th hour. Talk to you later, you guys.